So Sam, I'd like to ask you a few more questions if that's okay.
Okay.
All right. Do you feel like a boy, like a girl, like both, or neither? And there's no right answer.
He keeps telling me that he's a girl and that he doesn't like boy stuff. So we let him go by the name of Sam, which I like because it could be for a boy or for a girl. I don't know, I think he just wants to be like his big sister.
Dad, I told you, I'm a girl.
I'm sorry, honey. This is hard to understand.
So what do you say, Sam?
I'm a girl.
How long have you known you're a girl?
I don't know, but a long time.
So when we're talking about you, would you like for us to say he or she?
She.
Okay, thanks. I wanted to ask you a question. I'm asking all of my teenage patients this. I had your mother step out of the room because what we discuss here is confidential and private. But as your parent, she is able to look at your medical record for whatever we put on there. Okay, so what we discuss here, we could just talk about it. And there are certain parts that if you want me to just make note for myself, then I will make that note. Would you say that you identify as a boy, girl, transgender, or non-binary, or maybe some other gender?
Actually, I don't really identify as a boy or a girl. I know some people look at me and think I'm a boy, but it doesn't really bother me.
So for our system, I'm going to go ahead and put other. And we can have further conversation about your gender identity if you'd like, now or maybe at another time, but we can talk more about it to help you kind of navigate what that looks like for you.
Okay, that sounds great. It might be different the next time I come in to talk to you.
Awesome.
When the Medical University of South Carolina is pushing for children to hide things such as their gender from their own parents and have such secrecy between the doctor and the patient with very little questioning as to their mental health and psychological comorbidities, putting over 62% of their patients on some kind of hormone therapy or blockers, there's definitely an issue. It is our job as responsible adults to encourage children to be happy with the skin that they're in, to enjoy being who they were created to be. And we must also stand up against these places that are looking to profit off the chemical castration and the surgical mutilation of the children in our community.